We are live.
Namaste and a very good evening. It is indeed an honor to have my beloved President of Fogsi, Dr. Sunita Tandulwadkar ji, over here. As usual, in spite of all her busy schedule, whatever engagements, Madam is spot on here at 8 p.m. every single day starting 2025. And this Gyan Pravaha is the brainchild of Dr. Sunita ji, and she wanted each one of us 30 chairpersons to take up one day every month to speak to eminent legendary personalities in India and abroad and take forward their thoughts to the numerous people who will be listening to our podcasts. So, Dr. Alexander Thomas is the guest of honor today. And Dr. Alex, and for the information of all our delegates, audience, I know Dr. Sunita Madam is not a figure to be introduced. She is well known internationally as well as in India. Madam is the president of Foxy 25-26, and Madam runs the Solo IVF Center in Pune, as well as she works in the Ruby Hall IVF Center. And she has been a pioneer in stem cells and regenerative medicine in India. And Madam always has got a lot of new innovative ideas to give better health to women in our society. To name a few, Dr. Alex and my dear delegates, I would like to say the Gyan Pravah, the Do Tike Zindagi Ke, which all of us are trying to strive to give HPV vaccination to all our boys and girls out there. And then we have Anubandh, where she meets the president and secretaries of each and every society in India. From we have around 280 societies. Madam makes it a point to meet them. So these are just few of her programs. We have got Sampurna, which is again a health CME conducted all over the country, and many, many more to name. But Madam is so humble enough because she says, don't introduce me, it is your day. So over to you, Dr. Sunita ji.
Aarti, thank you so
Thank
much. Thank you. Aarti, evergreen, very hardworking,
Thank you, ma'am.
innovative, doing great job as a not only committee chairperson, but in her own field as a Kasuga president also. I observed her. She works with tremendous innovative idea. Thank you, sir. Thank you for on a Foxy platform today. And it's a great privilege to have you. Actually, this Gyan Pravaha I have started for my chairpersons. Actually, they become the future leaders. When you want to become a president, your entry point is chairperson, then you become a vice president and president. It's a long journey. So I thought I will give them a platform to be innovative, creative, have a good dialogue with someone that builds up their confidence. But believe me, sir, I am meeting nearly now 140 faculty across the country from academic, non-academic, from all the backgrounds, and more than my team members, I as a person got evolved. Though I don't remain with you both in this platform, I join the viewers link and I enjoy on a Bluetooth the entire discussions. And there is so much to learn from everyone. And I think now I definitely feel that Gyan Pravah was one of the most wonderful program of ours, apart from our Arogya Yog Yatra, Know Your Number, Sampurna, Do Tike Jindagi Ke, for many, many projects we run for our Foxians, but also for maternal and women health of India. So thank you so much for being our platform. And Bharti, I need to catch the flight.
Yes, madam.
But I will listen to both of you on my this thing.
Thank you very much, madam, for making time out. I was indeed
I love you all.
lucky to have you in between your flight.
Always.
Thank you, madam. Thank you very much.
Safe travel.
Safe travel.
Yeah, thank you.
Yes, thank you, ma'am. So, thanks to Dr. Sunita, ma'am, to making time out and being with us. And now we come to the most important part of our session. We have Dr. Alexander Thomas with us. And, to introduce Dr. Alexander Thomas would require quite a few minutes for me, but we would like to listen to his thoughts. So, I'm going to keep the introduction a little short. Dr. Thomas has served the healthcare sector for over 4 decades and held various positions in national and international levels. And he has been the founding member and the patron of the Association of Private Health Providers of India, and of which most of our hospitals do have a membership. And he's been associated with the Association of the National Board Accredited Institutions, that is ANBAI, and the Consortium of Accredited Healthcare Organizations, CAHO, and is involved in the formation of ANI. And he has been involved in various policy making decisions, especially to change the scenario of healthcare in our country. And I have been indeed lucky to be associated with him in many, very many of these sessions. And he has taken a very big role in trying to get all hospitals empaneled by the NABH, and he has set up guidelines for communication skills. Well, his resume, as I said, runs into pages. But then one more very important thing I would say about Dr. Alex is he has been the founder of Vaya Vikas, which is a foundation to cater to the health of the elderly citizens of our population. And in the national level, he has been involved in the government as well as the private sector in various policy making consortiums, policy making meetings, and he has been instrumental in bringing in various changes in the family welfare department as well as the health sector in the government of India as an advisor. And of course, he is an orthopedician by profession, and he has been the one of the CEO, the managing director of the medical director of the Baptist Hospital, under whose guidance the hospital reached greater heights. He continues to continue with his clinical practice. And he is an author who has written numerous books concerned about healthcare, communication, care, cure, a guide to healthcare communication, climate change and the health sector, healing the world, the handbook of healthcare, quality and patient safety, the handbook of healthcare he has written, the health law and ethics, critical reflections, prevention of violence against healthcare, in sound health. These are few of the books. He's got a numerous books to his credit. And today I think I would spend more time to discuss about his views about healthcare. And he has chosen a very, very pertinent topic today, that is lifestyle and medicine. Because gone are the days when we talk about just pharmaceuticals or surgeries and medicine. There is a very significant changeover in that scenario. And today, everybody is talking about either holistic medicine or lifestyle and medicine. So, Dr. Alex, I know I have very, very briefly introduced you, but I would like to have your views on what we are facing today. To welcome to Gyan Pravah, the podcast, the 140th podcast of our Fogsi. So, to set the ball rolling, Dr. Alex, I would just like to ask you, what is your view on lifestyle and medicine?
Yeah, thank
What
you, Bharti, and thank you for
Yes.
your kind words.
Thank you. Thank you,
Whatever
Dr.
we have
Alex.
done, we have, I think, done as a team, and all my
Yes.
colleagues, including you, have responsibility. So thank you, and it's been a pleasure. Thank you for inviting me out to this panel. It's strange, an orthopedic surgeon talking to OB-GYNs, but I always say that our medical students and our faculty are not exposed to the world. So I think this is a fantastic program that you have, where you talk about different aspects. It will empower our, especially our trainees.
Very true.
Yeah. So coming to the lifestyle medicine, I've been working now, as you said, almost 4 decades in the health sector, and I've worked in different positions as a clinician, a hospital director, an educator, a little bit of policy advice. And I think one thing that I've come and which has hit me hard is that 80% of the disease burden in our country is preventable. And that's saying a lot. So most of our hospital beds today, if you look at, you have diabetes, heart disease, strokes,
Yeah, the
obesity.
non-communicable diseases.
Yes, cancers and mental health. And they can actually be prevented or reversed with changes in how we live, not just how we treat. But I think all of us will agree that today our healthcare system is still, it is built around treatment, not prevention. I think that's something that has to change. We
Yes.
wait for people to fall sick.
Come with disease. They come.
Yes.
We wait for them to come with
Come with
disease.
disease and then spend enormous resources and money trying to fix what we could have easily avoided. So if you could change this, if you could truly adopt prevention as a foundation of healthcare, our country would not only have billions, save billions in healthcare spending, but our people would be much more productive, will be resilient and healthier. So I think one of the questions is, how did I get into lifestyle medicine?
Yes, yes.
Over the last few years, every few years, we have tried to choose something which is relevant to the healthcare profession. As I said earlier, that our medical professions are focused only on clinical medicine, and they don't know much about finance, they don't know much about law, etc. So over the years, we have focused on law. The last area that we worked on was on senior citizens. And this time, over the last couple of years, after I finished my last book and the last health conclave on senior citizens, we were looking for a topic. And then what better than prevention is better than cure? So that was
Definitely.
Yeah. So then this led me to interact with the lifestyle medicine physicians. This is a specialty working in the intersection of nutrition, physical activity, sleep, mental well-being, and stress and management. So at the same time, I noticed that something else. We were talking about WhatsApp and social media a little while ago. Misinformation was exploding, especially on social media. With
Yes.
So I remember reading an article maybe about 2 years ago, where a woman in the US claimed that she had been on a diet of oranges for 2 years and she became perfectly healthy and
Rid of all disease.
yes, rid of all disease. And another guy who says, I sleep only 1.5 to 2 hours a day and it keeps me fighting fit.
And unfortunately, most of these are by non-medicals. People have no knowledge of the body, the human body at all.
Absolutely. And as doctors, we know that this is not only it's misleading, it is actually downright dangerous. So we thought that we need to, especially in our country, that we need a credible science-based document on lifestyle medicine, one that could relate debunk myths. In our book, each chapter has one thing saying debunking
the myths.
Yeah, and then educating the public and serve as a guide for both professionals and others, and especially serving the Indian context. So with this in mind, I think we got some very outstanding and extraordinary authors, including Devi Shetty, Dr. Pratima Murthy from NIMHANS, Dr. Randeep Guleria, the former director of AIIMS, and many other equally eminent people, all leaders in public health, internal medicine, mental health, etc. And the result was our book, The Science of Healthy Living. And as you know, it's evidence-based, multidisciplinary, and written for everybody. It's for patients, for policymakers, and for healthcare providers.
As you said, Dr. Alex, I think we as medical professionals are trained in medical school mostly to talk about disease and its treatment. And of course, though we are taught about preventive medicine, I think somewhere that has taken a backseat. And such books are a definite read so that we can get enlightened ourselves as to how these simple steps of lifestyle modification can lead to tremendous improvements in health in our country as well as globally. So my prescription always has the first line as lifestyle modification. For whatsoever reason, they come for infertility or they come for PCOS, I write lifestyle modification and then I tell them what is lifestyle. So taking this forward, how can we modify our lifestyle for the better?
So
what would be your tips?
I'll just talk a little bit about the impact of lifestyle in the present day.
Yes.
I think, as you said, lifestyle is the biggest contributor to disease and early death in India today. Then looking at our country, I think we need to realize that we are no longer a country dealing with infectious diseases. That was earlier on. But now we are actually facing a tidal wave of lifestyle-related conditions. And as you said, they're all known as NCDs. And this is actually very worrying, and we need to actually address it. So just to share a few of the data.
Lifestyle issues that impact health.
Yeah, no, just to come to reality and say, what is the situation in India? We have close to 80 million people in India living with diabetes. 1 in 4, that's 25%, have high blood pressure. obesity, we are supposed to be
We are
developing.
almost, yeah, that is not poverty, but undernourishment, I would
Yes.
say.
So altogether, 135 million Indians are obese or overweight. We all know that cardiovascular disease is one of the leading causes of death. And related to your field, 1 in 3 women of reproductive age, I think I'm sure you'll agree with
Yes,
this, are
yes,
anemic.
diabetes,
Anemic. Anemia
anemia,
means
diabetes, and
yes.
hypertension.
And we are also, I think this surprised me that we are home to the second highest number of children with type 2
Yes,
diabetes. So
that's
it's not
because
about, yeah.
there is a fetal programming of the adult disease in these malnourished women.
Yes, yeah. So it's not about numbers. I think it's about a generation which is growing up, and that they're growing up unwell, and we are
Yes,
huge numbers. And it's not because of lack of access to medicine. I think it's the persistent exposure to processed foods. And here I'm talking about not the people in the rural area, but it's catching on there also. It's processed foods, lack of physical activity, poor sleep, and unmanaged stress.
stress,
And of
mental
course,
stress.
I mean, very alarming that among children, you're seeing children who are becoming obese before they reach the age of 10 years. These are all very, very alarming statistics in today's age. And I think, again, in relation to children, some very alarming facts in our country is that they are developing early signs of insulin resistance and fatty liver. And
Yeah,
all of us know that most of our kids are spending 6 to 8 hours on screens, and
on
but how many
screen time, yeah,
percentage? Yes, on that.
sedentary lifestyle.
Yeah, and many of them are because of this experiencing anxiety, poor sleep, and even early hypertension. So if we do not act now, we are normalizing illness at an early age, and I think that is something that we have to keep in mind, because it's for the nation's productivity, economy, and the human potential.
Yeah, so Dr. Alex, you have very well put across what is the alarming impact of these lifestyle habits causing the on our population. So how can we modify them? Because now we know that lifestyle is not okay. We are sitting on a huge volcano of all these non-communicable diseases, and the young children are growing. As you said, we're normalizing illness in them. So, how do you think we can modify our lifestyle for the better?
Yeah, before I go on to how we can modify, I'll just a word about as doctors. I think it's important, since I think
Yes.
our audience is doctors. I think we need to look after ourselves. Our long work hours in India, skip meals, lack of exercise, chronic stress, and lack of sleep. I remember when I was doing PG in Vellore, we used to hardly sleep 2 or 3 hours a day, and we thought we were heroes. But I think that
Yeah.
we need to change, and also our training. Some of the facts that some of our doctors, a significant percentage of our doctors are overweight or hypertensive. Many of them we know burnout, anxiety, and often we are the last to seek help. So I think this is very tragic. So coming back to the question that you asked on how can we modify our lifestyles for the better. And I think the great thing about lifestyle medicine is that you don't need any external
Yes.
appliances. You don't need external.
It doesn't cost. It doesn't
It doesn't
cost you
cost.
anything but your time.
Yes, yes. So, and I think it's also important to realize that we are in India. I mean, where we have actually been taught by our ancestors how to live, but we have forgotten now what to do it. So I think we don't need new inventions or expensive inventions. We just need to return to what we already know, especially in our country,
Yes.
and do it more consistently and little more scientifically. So if you look at our cultural foundations in India, I don't have to tell the audiences, our forefathers practice Ayurveda, yoga,
Yoga.
seasonal eating rooted in locally grown natural foods, and daily routines that respected the rhythm of the body, the sleep cycle, etc. But somewhere along the way, I think we have traded wisdom for convenience.
Very true.
We're going into processed foods and unhealthy habits, and live in a world of hurry-burry, which I think we need
Yes.
to again look at. So what is, as you were talking, what is the science behind lifestyle, and how can we modify our lifestyle? So we need to know a little bit about the science of behind lifestyle medicine. And basically, the lifestyle medicine, people look at 6 pillars. That is whole food, plant predominant nutrition. I think that's one. aspect. Doesn't mean that you cannot have other food, but
Yeah, I
main
mean,
focus.
you have to balance it. You have to
You have to
balance
balance it, yeah.
plant-based food and animal-based food.
Yes. Then a regular physical activity, very important, as I mentioned earlier, that restorative sleep. I think it is now becoming increasingly important that sleep is a very important aspect of health. Stress management techniques, especially in the hurry-burry of this world, avoidance of risky substances like tobacco and excess alcohol, and very importantly, social connections, positive social connections. So these are the 6 pillars on which the lifestyle medicine people base their science. And I mean, I'm talking to medical people, so we have to actually have some sort of backing medical evidence. So in a study in the Lancet, which I think many of us read, show that 90% of type 2 diabetics it can be prevented with simple lifestyle changes. Another study in Harvard showed that just 30 minutes of brisk walking a day can reduce heart disease by 36%, almost by a third.
Yeah.
And we have all heard about the Mediterranean and Indian vegetable diets
Diet.
that have been shown to reduce cholesterol, etc. And then mindfulness, prayer, they know to reduce stress hormones and improve immune function. Nimans has done a lot of work in that. And improving sleep, just improving sleep alone reduces the risk of obesity, hypertension, and depression. I just want to tell you all these things are available in the book.
In your book, I know.
As a free.
Yes. So we will be sharing the information of your book also on that. And I think if we Google Dr. Alexander Thomas, the book list of books are out there. And coming to what you were talking about, the impact of lifestyle, and you talk about sleep. There is something alarming we should all be noting, that with the increased peer pressure on adolescent children and college-going children to score good high marks, we are seeing that most of them are sleep deprived, leave alone the poor nutrition and the diet they are following. And this sleep deprivation, I think, is leading to a lot of mental health issues in the younger population today. And I think this is something that the medical professionals, as well as the people around those children and adolescents, need to take note of. Because otherwise, as you said, we are going to see a population which is not able to handle any single amount of stress, probably because they're already mentally unwell. And schools and colleges are not focusing on the mental health of the children. Parents are not bothered about the mental health. They only want them to score or be good. They put a lot of stress on them. And we as medical professionals also, I think somewhere down the line, we are not spending enough time to assess their mental health issues. We are more addressing their physical health issues. So could you just tell us a few lines on this?
Yeah, so actually during COVID, we did a very interesting exercise. We actually bought out a book when kids were going back to school. Parents were not willing to send them because they were scared. So we bought out a book saying going back to school. So seeing that, the Ministry of Education, Delhi, contacted us and told us that children in schools going back to school, a lot of mental health issues. And so we actually came out with a program to help teachers identify mental health issues. As you say, in the present world, there's so much of competition and so much of unhealthy competition focusing on the future that people, parents especially, are not aware of the consequences of this. And I think as medical people, I'm sure you also, even now, we don't take care of ourselves. We don't have enough sleep. So I think the first thing is we need to take care of health.
Start from home.
Charity
starts from home, right?
And yes, we need to actually sensitize the public. And I've written a few articles based on the book on the importance of sleep, etc. So I think it's a collaborative effect. And also, kids must ensure that they go for exercise. Because one of the studies shows that they spend 6 hours on the screen and just 10 to 15 minutes on exercise. So these are things.
Hardly any exercise they do. Hardly.
So I think it's very important that we have to change this. It will take time, but we start with ourselves, sensitize the public, and also sensitize the policymakers to make changes. And I think, having said that, the government of India is quite proactive. I think the last when I looked, they trained 40 lakh teachers in government schools to focusing on mental health, which is a very important part of it.
Yes, they do have a program where they're supposed to identify those people with any sort of mental health issue and report them to the authorities for further counseling.
So I was convener of that committee. It took us 2 years, but it was very interesting. We had a lot of teachers, and
Yeah.
it was good to hear their
Yeah.
perspective.
Yeah. And but the other issue we are facing here is the parents are not ready to accept that, because still that stigma of mental health issues are there. So I think we have to create a lot of awareness. See, mental health does not mean that you're mad
Yes.
or you're crazy.
Mhm.
Because people think that if you go to a psychiatrist or a psychologist, you're labeled that you're mad. It is not that way. It could be just a lack of sleep, loss of appetite, or some mood changes. As subtle as that could be an harbinger of a serious mental health issue, which have to be identified.
And I think as medical professionals, we have the advantage. We have a duty to also keep educating our patients. They see
Yes.
the parents. So I think that is something that we need to do. We're trying to get this introduced in the curriculum, like we got communication. Let's hope it works.
So, Dr. Alex, we have now come to know that yes, lifestyle has a major impact, and there are a lot of discrepancies in the present day lifestyle. So, what are the practical tips that you would give for maintaining a good lifestyle for medical professionals and for the public?
So I think, as I said earlier, I think the first thing is that we need to practice what we preach.
Yes.
So I think starting with that, but just quickly going through what are the practical things that we can do as healthcare professionals and as leaders in society, because the community actually looks up to us too, and they actually listen to us and sometimes are influenced. So I think some of the practical tips for maintaining a good lifestyle, as I said, the core pillars. One is nutrition. So at the cost of repetition, I think we need to advise and also follow ourselves to shift towards plant predominant diet, not plant-based, but predominantly plant-based diet, more fruits, vegetables, lentils, millets, nuts and seeds. And the government of India is doing a phenomenal job in this, because whenever I go now for breakfast and when I stay out, I always see that there are millets and
Everything is available.
everything is available, which is good. And we also need to reduce ultra processed foods, because among the teenagers, that's very, very popular. Sugary drinks is a no-no. Excessive oils you must try and avoid. And our own Indian traditional diet, we don't have to go very far. Our Indian traditional diets, we actually wrote a cookbook from different parts of the country. All of them are rich in fiber, spices like turmeric and ginger, and they're naturally anti-inflammatory.
Yeah,
And
the
yeah,
herbs, and we
and
have the
heart friendly.
antioxidants.
Yes, all of
We
them.
have all of them in our diet,
And
in
like
our food.
like our ancestors, we need to use local and seasonal produce, because they're more nutritious and more affordable at that time. And one of my dietitian friends, what they say is follow the plate rule. Half your plate vegetables, one quarter whole grain, quarter protein. That is dal, legumes,
Yeah.
curd, etc. So I think that would be the same. So
Yeah.
that is about nutrition. Now looking at physical activity, I think the importance of exercise is now coming out. And the international guidelines, Indian guidelines are that aim for 150 minutes of activity per week, like brisk walking or cycling, or 75 minutes of intensive activity. These are general thumb rule across all ages. Uh, More recently, over the last 6 months to 1 year, the importance of muscle strengthening exercises, resistant exercises.
Yeah, I think that is
Especially,
very important.
yes,
This muscle strengthening,
yes,
because most of our elderly population, I think, suffer from muscle weakness
yes.
rather than or the bone problems.
Problems. And so, and the simple things where you don't need weights, you can just do squats, you can do push-ups. So
Yes.
that has now actually been coming to work and has going to be very useful. And now they talk about sitting. This is something which has come out over the last 6 months. Sitting, that you shouldn't sit for very long. Every 30 to 40 minutes, get up. If you have a desk
Oh,
job, walk around a little. And one of my authors also said that walking after meals is very useful. Even a 10-minute walk helps control blood sugar, especially important for India's growing diabetic.
population. Mm.
Yeah, so those are two of the pillars. Now coming to the third pillar, we're talking about we're talking about sleep. Yeah, we come back to the important this thing of sleep, which is so very crucial. And the third pillar of lifestyle medicine, we say adults require about 7 to 9 hours of sleep every night. And to make sure you get good sleep, avoid screen time in our
Any electronic gadget in your
so I think
bedroom.
all of you, the people who are listening to the podcast will have to go to sleep from 11. And as you said, inadequate sleep causes obesity, causes a lot of mental health issues, and causes heart disease. So try and focus on that. Stress management. I think all of us realize the importance of taming the inner storm. So chronic stress can, we all know, leads to hypertension, ulcers, burnout, and depression. In India, yoga, deep breathing, meditation, prayer, just 10
Yes.
minutes of this can lower your cortisol. And I think what is now catching on is laughter clubs.
Yes.
Laughter is very, very good
Medicine. Laughter is good
medicine.
medicine is a
Yes,
very old proverb,
yes,
but
yes.
now is coming back into practical use.
Yes, and then music and pets have been shown to reduce stress. And I think something which I have now, a lot of positive feedback is coming to keep a gratitude menu. When you're thankful, I believe it increases, it rewires the brain towards positivity and reduces stress, because stress is a major problem, especially of those of us living in urban, and especially those of us in the medical profession. And healthy relationships, which I mentioned earlier, is very, very important. Actually, it comes high on the list of the
Yeah.
pillars. And loneliness, if you ask me, which is the most rampant disease in our country today, in spite of the culture that we have, the family system, it's loneliness. And loneliness increases the mortality risk by 25%. It's very significant. And it will be a miserable existence. So it's very important to nurture bonds with the family, with the community, and with friends, and try and be part of a larger group of faith community, etc. So I think that is something which is, when writing the book, I realized that it's very important.
Yeah.
The sixth and seventh, sixth is avoid harmful
Substance
substances. And that
abuse.
is, I think, as we say, it's very obvious. For doctors and healthcare professionals, I think it's important that we need to practice what we preach. It's very easy for us to forget self-care, and we know that all of us are quite stretched. If you look at the ratios, there are not enough doctors. But we have to realize that burnout and heart disease among Indian doctors and are very real and also increasing, and especially among OB-GYNs, because you're under a lot of stress. I remember when I was director of Baptist, all the major issues were the gynecologists, and I felt very, I mean, I supported them, but I knew that they had a very difficult time. And we also advise doctors in between surgeries to stretch, walk during rounds, stand during calls, and important that you nourish, don't snack. Try and keep some nuts and fruits with you, homemade food. Avoid oily samosas. Avoid
Coffee, tea.
sugars.
I
Yeah.
mean, we surgeons and obstetricians, we try to have a lot of coffee and tea, thinking
Yeah.
that is going to keep us going.
Yeah. So what they avoid is small quantities of black coffee is okay without sugar.
Yeah.
So then, and then very important, as we said, it's how to we need to decompress. The doctors, at least maybe 5-10 minutes of just deep breathing, sitting in the car by yourself. And if help is needed, I think we doctors are famous for not going seeking help. If help is needed, we need. So I think these are the things, some of the major things that I would suggest.
Yeah, and I would like to add here, Dr. Alex, that for doctors to be stress-free and to have a very comfortable workspace, I think we should step into group practice. Because as you said, emergencies you're tackling on your own as an obstetrician, you're in an emergency or you're held up, that leads to a lot of stress. And this can be relieved when we start having the system of a group practice. We have somebody to fall back on, we have somebody to call for help. And I think that, I mean, in my personal experience, that relieves a lot of stress in your clinical practice.
No, I agree. I remember when I was in practice. I don't do too much of practice, and when Glory, my wife, was in practice, we were on call every alternate day. So after
Yes.
our duty, we were on call. But I think that is changing now. Like in the ICU now, I know that earlier it was the consultant used to come during daytime and
Every call.
but now they have 3 shifts. So I think
Yeah.
things are getting better, but it'll take a while because
Still, for example, in the places like Hassan or any other semi-urban place, we have single doctor-owned hospitals still today. And there we are on call almost every day. Of course,
But
as
I
you
think
said, so
yeah,
unless we have a practice with a group, it makes things easy for us. And we need to understand that we have to support our body and mind also,
absolutely.
rather than just going behind our patients who come to us.
No, I think it's very important. I hope that with this podcast, people, colleagues will realize that even if
Yes,
they're owners of a hospital, that they need to switch off for some time. Because I know that,
exactly.
especially in India, 80% of healthcare is a smaller nursing homes run
Yes,
by couples, and they're under tremendous stress. So yes, I
stress.
think group practice or some other where they get time for themselves, time for exercise, get adequate sleep, eat well, and remain healthy and show their patients how to remain healthy.
Yeah, so that's what, when you were talking about the diet, there was very familiar saying which I tell my patients who come to me: eat seasonal, regional, and traditional food.
Good, okay.
So that is the best nutrition you could have. Whatever is grown in my own town, what is grown in Hassan, eat it in Hassan. What is grown in Punjab is eaten in Punjab. So that way, it not only is good on your health, it is also good on your purse.
Yeah. But all of us are not fortunate to be in a place like Hassan.
No, no, I mean, it's
No, no, I
regional
got your
food. I
principle. Yes, yes,
wanted to
yes,
say is
yes.
about regional food.
Yes, no, as I said earlier, no, what is locally available,
Yes,
not only it's also more affordable.
affordable. Yeah, that's what it's going to be, light on your purse also. So these are some very simple things that we can incorporate in our lifestyle, which can have a tremendous effect. And you very well brought it out that we as doctors have to have some sort of a healthy snacking in between our busy schedules, and try to see that we have our regular meals, because most often, most of the healthcare personnel, you call them at a 3 or 3:30, they wouldn't have had their lunch yet.
Lunch, yes.
So either a fruit or a nut, so something around 10:30, 11, I think we have to look after ourselves, because we are a very limited edition people around the world, and the
Yes.
world needs us. The world needs us. And now, come, let's moving closer to, you said, what's an orthopedician doing here in an obstetric and gynec podcast? But this podcast is for everyone. So, what is the effect of lifestyle on maternal health? Because we are still striving to reach good maternal health standards in our country.
Okay, so I think that's irony of it. I think you know far more there, but let me let me talk a little bit about the impact of lifestyle on maternal health. So I think you can hear me.
Yes, 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 Dr. Alex, we can hear you.
Okay, okay. So I think one of the most critical but overlooked areas in lifestyle medicine is its impact on maternal health, and that's why this question is so very important.
Yes,
The health of women during pregnancy, during childbirth, and also in the postpartum period. In a country like India, where maternal and child health are major public health policies. So it's more than just a medical concern. It's a social and development imperative. I think it's very crucial. So just starting off with some figures in India with regard to maternal health. As we said earlier, anemia affects more than 50% of the pregnant women.
pregnant women.
And gestational diabetes, it's about 10 to 15% of the Indian pregnancies, which is actually quite
Yes,
high. And many of this anemia, this gestational diabetes, they go undiagnosed until complications come up. Maternal obesity and sedentary lifestyles also are on the rise, like in the other segments of population. And this is true especially of the urban areas. So this actually leads to higher rates of preeclampsia, cesarean deliveries with postpartum complications. I'm sure you can
yes.
confirm this coming from an orthopedic surgeon. And the other important aspect which needs to be addressed is pure nutrition before and during pregnancy.
Preconceptional care is something that is being addressed now, even by our Fogsi, Dr. Sunita Madam has come out with this
Okay.
Sampurna program, where we
Okay.
are trying to speak about preconceptional care. That is the the strongest foundation for the next generation.
Yeah, and as you know, this contributes to low birth weight, and this in turn is a
Yeah.
predictor of adult chronic diseases, and which we now call developmental origins of health and disease. And I think also in pregnancy, we should not forget the impact of mental health and stress. And in our country, unfortunately, women still bear the brunt of this. They have to Many of my colleagues had to work even during pregnancy, then go back and look after the house.
Yeah, no support, no
No
support
support.
system.
So I think this is very common among our Indian women who are they're looking at juggling domestic, professional, and societal roles. And depression during or after pregnancy can affect both the mother. I think that's also something that is well known, and the child's development. So, looking at, I mean, scientific, again, coming back to scientific evidence for this, uh, again, in the British Journal of Obstetrics and Gynecology, this is a study in 2020. It said women who engage in moderate physical activity like walking or prenatal yoga had a 30% lower risk of gestational diabetes. I think that's
Yes,
backed up what we already what we know. And
discussed.
there's also we know that the one of these studies shows that there was a significant reduction in excessive weight gain, preterm birth, and preeclampsia. And this is especially relevant to our country because in the West they have a lot of exercise programs, etc. In India we don't have, so that's very common. And also dietary patterns and pregnancy. It's again, there's an article in the New England Journal of Medicine, which published a research article showing that the adherence to a Mediterranean style diet. More details are given in the book if you want. These are basically diets which are rich in proteins and
Nuts and seeds
yeah,
and
all of that.
vegetables, more
Yeah,
of plant-based food.
So I believe a diet, if this was followed, the risk of hypertensive disorders went down in pregnancy went down by 35%.
Very significant
Very
because
significant.
yes,
And was also associated with improved fetal growth and brain development. So I think Indian diets can easily be aligned with these principles because vegetables, whole grains, curd, home cooked meals. I think we have these diets which are not overloaded with the processed
yeah,
oils, sugar.
provided they follow the traditional way of
Yes.
eating.
Okay. And then in gestational diabetes, I think this is something that they were doing in Vellore. The CMC, the Department of Lifestyle, where I interacted quite a bit because we wrote this book together. Medical nutritional therapy and walking 30 minutes daily and targeted education significantly reduced the need for insulin in women with
Gestational diabetes.
So this was something they're doing in which actually Dr. Sam, the head of the department, was talking to me about. And also that lifestyle changes during pregnancy also reduced the child's future risk of obesity and early onset diabetes.
Yes, that's the fetal programming of adult disease. We can reduce that
by up to 40%.
Yes,
So it is quite significant.
Significant.
So I think.
Yeah. So as you said, we need to, we know, most of us know that lifestyle can impact maternal health. But I think we as clinicians should either have a counselor in our setup or we take time out to counsel our to-be mothers, to-be parents, I would say, to-be parents, because when we're talking about lifestyle and maternal health, I always say I will speak about the parents because the lifestyle of the male partner, that is the offspring's male parent, the father also, his whether he's smoking, he's taking alcohol, or his history of any diabetes can also impact the fetal health. And this fetal programming of adult disease is a proven theory with lots of evidence today. And if we do not address the gestational diabetes issues, we do not address anemia much before she becomes pregnant and during early pregnancy, we do not address the mental health issues, these are going to have impacts on the to be born fetus. And the next generation, we will see further increase in non communicable diseases. So I think when I speak in my consultation nowadays, I speak to them almost, I take 2 to 5 minutes to speak to them about just lifestyle and put it across in very simple words, because generally we have a lot of printed charts available which we hand out, but they will not read it, and neither will they look in, neither will they take it home. They will just throw it in the garbage and walk out. So we try to give them pictorial descriptions on their case sheet and tell them that this food plate concept we try to tell them. And there I use the colloquial, the local language used, and tell them what you have at home. You have your sesame seeds at home, your jaggery at home, you have your coconut at home, you have your dal and your other nuts, pulses which you're growing, you have your millets which you're growing at home. So we have to talk to them in simple language, keep it short, and be open to questions. So if we spend time with them to talk to them, one about preconceptional care, that is very, very important. We have opened up this window, but then I think all of us have to get into that and start talking about preconceptional care. And the policymakers have also incorporated it, but still preconceptional care, only 3 to 5% of our to be couples come for preconceptional care. So we need to start talking more and more and giving more and more of preconceptional care starting from adolescence or even much earlier than that. Because if a girl is not anemic when she's 17 or 18, we can be sure that when she enters parenthood, she may not be anemic.
No, I think it makes sense, and especially as
Yes.
obstetricians, that 3 to 4 when somebody comes to you with pregnancy, I think you have a critical window of opportunity, and just 3 to 4 minutes of talking to
Yes.
them will make a huge, and that's a time that they're highly motivated to make
Yes.
changes. So just spending a little time, not very much, 4 to 5 minutes, I think reduce the complications and make sure that the children
Offsprings are healthy.
for a lifetime of better health. I think that's
Yes.
very important.
Yeah, because we have seen that children who are born to mothers who are anemic or hypertensive or gestational diabetes, there are a lot of neurodevelopmental
Yes.
delays in them.
Yeah.
So when we talk to the parents about neurodevelopmental delays, they are very proactive in accepting whatever lifestyle modifications we are trying to tell them. So I think the first prescription should be lifestyle. The second should be whatever supplements we are going to give them.
Yes, absolutely.
I think that message should be put across by all our healthcare personals so that we have a healthy generation next.
Yeah, and it will save, I mean, apart from the money, it will save so much of suffering,
Yes, suffering,
Just
true.
a little bit of input at the right time. So I think that is what we are trying to now do through the book and through our recommendations to the government, etc.
Yeah.
And I'm so glad that you are already practicing it, and because our residents also look to us.
Yes, they generally look to us and see what we are saying. And the couples are very proactive because they're quite happy when we are not just prescribing them a calcium or a painkiller or some drug and sending them out. You sit and show them some things and talk to them about food and talk to them about exercise. They are extremely happy about it.
Yeah, no, and I think we need to tell them that the most powerful medicine is not drugs or this or that.
Yes.
It is they have it within them. They have the pillars, and they have control over it, and they can make a difference.
Yeah, I think that slowly there is a shift. But as you said, as medical professionals, if we could give them the right message rather than somebody on the social media just
Yes.
giving them some messages which are not right.
That's very
And I think
important.
in that way, the number of books, the numerous books you have written on various issues on health, I think will contribute and will be a must read for most of us so that we can incorporate all those points in our clinical practice. There's no
No,
use
I
just
must.
reading a book and putting it aside.
No, I must thank all my books. I'm not a very good author,
Okay.
nor am I an expert in lifestyle medicine. But all the authors, for all the books,
Yes.
it's all been given pro bono, and that's why we make it available free.
Yeah, that's what. See,
I
an
must
editor
thank
is a very crucial person in bringing out a book, and the messages which go out from this book will definitely help. And I think now the medical education, because you have been into a lot of policy changes in the NMC and the medical education system. And I think surely you would have also put in all these factors, which I think young doctors have to talk about lifestyle in their clinical practice. I think we have to see that it gets utilized and it gets incorporated as a day to day. Just like we see a blood pressure and a pulse rate, it should be a normal phenomenon to us to talk to them about exercise and nutrition.
I think it's important. So that's why we are trying to get it into the curriculum. I was
Medical.
lucky in communication, but this is so crucial because if you are able to change from curative to prevention and just using what you have, exercise, sleep, etc., I think you'll have a whole generation of Indians who are healthy, and who will make India a superpower. So we are trying to.
Yeah, I think we all need to join hands together.
Yes,
It's, as you said, a teamwork, and each one of us, whether we are in a small hospital, big hospital, whether you're in rural area, urban area, whatever so specialty we are in. Because I always tell my colleagues in other fraternity, I said, if they may come to you as a geriatric patient, they may come to you as a cardiac patient, they may come to you for an orthopedic problem, or they may to come to a pediatrician or a psychologist. Please spend time to speak to them for a few minutes on lifestyle, for whatsoever reason they may come to you.
Oh, very important, because when I was writing the communication book, I discovered that in a developed country like US, I was in Australia. So during our OPD, we didn't have more than five or six patients, and we didn't have to do rounds. We didn't.
Okay.
Yeah, we see 50 patients, but in the developed countries, in spite of so much time, uh, you're supposed to listen to a patient, but there
Yeah.
within 18 seconds of a patient talking, the doctor would intervene. So.
Yeah, communication skills do matter a lot.
Yeah.
I think that is also what many of our patients who come to us do say, that doctors don't spend enough time speaking to us. I think this also has to be turned around.
Yeah, and also, I mean, since I hope some students are listening to this, that they say just spend 1 minute more with the patient, and that makes a whole difference.
Very true, very true.
So it's really
And
not
some
very
casual talk before you come to the problem itself.
Yes.
That itself is medicine for them.
Yes, yeah,
Because I have numerous people who come to say, Doctor, I'm fine. I just came to say, my wife has come to say, because the moment she comes and speaks to you and goes back, she's okay for a year.
No, and I think we are shifting a little bit, but communication has actually been known to greatly impact outcomes. Studies have been done.
Yes, yes, very true.
The outcomes are far, far better.
Yeah. So I think we are coming to the end of the program, and we thank you, Dr. Alex, for spending your valuable time and inputs on this very, very useful topic as lifestyle is medicine. Because we used to say laughter is medicine, and now laughter comes into lifestyle, which you have very well brought across. So lifestyle as medicine, it could be nutrition, it could be our exercises, it could be the mental health issues. And one thing which I very well liked about is the social, try to have a circle of social friendship around you, or try to volunteer. I tell many elderly people who come to me and say that we are having some sort of issues, maybe psychosomatic, it may be depression, it may be loneliness. I ask them to come and just sit in my hospital and talk to me for some time and get back. And in that concept, I think that's where you started the Vaya Vikas Foundation, which is really a boon for those elderly population of ours who need much needed help, because their family may not be around for them when they need.
I must tell you this before I close.
Yes.
In Vaya Vikas, we started about 3 years ago, and Chris, Devi, and I started it. And we're offering various services. So we wanted to do something called a Hiriyara Habba, get seniors together. So the first one, we were very anxious that we will get 200 at least. We were trying for 200. 2,500 people came.
Yes.
And you have to be there to believe the energy. You know, they were so positive and so energetic, like kids. So I think it's very.
Yeah, they wanted that companionship.
Yes,
I think.
No, I think that's something we are now trying to work on a different thing, trying to work with senior citizens, making sure that they have a dignified and empowered life.
Yes, they have someone to talk to.
Yes.
Because what I've heard in Western countries, there are people who just go out and spend some time with elderly citizens, reading or walking with them and talking to them, and that acts as medicine for them.
Yes. It makes a big difference.
Studies
have shown that.
They just want somebody to speak to.
Good.
So I think it's been a wonderful discussion where we are talking about the very, very easy nuances of having a good life for not only the elderly, but also for the adolescents, for mothers to be, and for the future generation. So we thank you, Dr. Alexander Thomas, for spending your valuable time here. And my pranams to our President, Dr. Sunita Tandulwadkar, for conceptualizing this excellent podcast, Gyan Pravah series. And my thanks to our support team of Gyan Pravah, the Evangel company. And very, very good night and happy life, sound sleep to all those listeners who are listening to us. And please go back to sleep. So you need 6 to 7 hours of sleep. You need 45 to 50 minutes of exercise, and you need a good, colorful plate of food on your table. Thank you very much, and pranam.
Thank you.
Yeah.
Thank you very
Namaste.
much. Namaste.